Welcome. You may be wondering whether or not to download this short ebook. You may be watching this because you recognize that there is more to getting great clinical outcomes than the procedures that we do to patients. You may already recognize that to get great clinical results in therapy, the patient must be an active participant. Any therapy, psychotherapy and physical therapy, is a process of change that requires engagement with a treatment plan designed to create the necessary psycho-emotional or physical adaptations, often both. We know that if our patients stick with the treatment plan, we can help their minds and bodies to adapt and teach them skills that make them more functional so they can get back to doing the things that they want to do. But how can we consistently achieve this kind of success? Many in the healthcare system have professed the need to be patient-centered. I understand this concept. It makes even more sense when you consider why we need to become patient-centered. Healthcare providers in the not-too-distant past were entrenched in using a biomedical model of care. This essentially disconnected the person from the patient with terrible results. The call to become patient-centered was a response to the problem of being expert or provider-centered. You might think of it as a pendulum that swung from one extreme to the other center of care. However, this creates a new problem. Have you ever been in a one-sided relationship where the focus is all about the other? Right, it does not work. I and others are trying to make the case that it is not about the patient or the provider. It is what happens between the patient and provider. Our efforts to get better therapeutic outcomes should be understood as relationship-centered care. As I outline in this workbook, it requires 3 steps. Number 1, know the science. There's been a rapid expansion in our understanding of the therapeutic relationship. Much of it comes from psychology and neuroscience. However, many researchers are studying the impact of the relationship in medicine and physical therapy. I believe we are truly on the cusp of some important discoveries. However, to learn any new skill well, you must learn how and why these skills work. Number 2, you must learn new skills. These skills will increase your confidence in communicating a treatment plan in a way that increases the likelihood that the patient sticks with it. Many of these relationship skills have evolved from the field of psychology. I have integrated skills from multiple theories in psychology into 10 foundational skills that I believe will have the greatest impact on your practice. Step 3, integrate the skills. There are many benefits to integrating these skills into your practice. They will help you better relate to what some would consider difficult patients. These are people who often leave us feeling drained and over time burned out. Develop a therapeutic relationship that increases the chance that your patient sticks with the treatment plan. This will translate into fewer cancellations and no-shows and increase the likelihood that your patient will stick with the treatment plan and get the therapy they need for better clinical outcomes. Some of these skills you may already be using without even knowing it. But when you become more aware of these relationship skills, you are more likely to develop a successful connection with your patients and better outcomes. All of this in a simple workbook? No, but it will get you started with some thought-provoking questions. After you finish interacting with some of the simple exercises, let's connect. I would love to know what you think. There are a couple of ways to reach out with comments and questions. I have a Facebook group dedicated to sharing content and discussions. I know that LinkedIn is the preference for many, so that will also work. I'm occasionally on Twitter. And lastly, I'm still old school and don't mind a direct email.